This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending neurosurgeon.
And I'm Dr. Alara, a research fellow. Today we're looking at a fascinating new study from the journal Neurosurgery titled Pediatric Intracranial Infections Requiring Neurosurgery, a German multicenter analysis of 10-year trends pre-COVID-19 and post-COVID-19.
This is a timely paper, Ilara. We've all had that feeling in the call room lately that we're seeing more of these cases than we used to. This study, led by Dr. Daniel Dubinsky and a large group of collaborators across Germany, actually puts the numbers behind that intuition. It's a multicenter retrospective analysis looking at a full decade of data, from January 2014 all the way to October 2024.
Exactly. And because it's multicenter, including institutions like Rostock, Essen, Jena, Mainz, and several others, it gives us a very robust look at the German landscape. They specifically looked at children who required neurosurgical intervention for intracranial infections. We aren't just talking about simple meningitis here. We are talking about the cases that end up on our OR table.
Right. Let's define the scope. The study included epidural abscesses, subdural empyema, cerebral abscesses, ventriculitis, and cases of meningitis that required surgical management, perhaps for ICP monitoring or washouts. These are rare conditions, but as the authors note, they are absolutely life-threatening and require immediate neurosurgical care.
The methodology is straightforward but powerful. They stratified the patients into two groups, those treated pre-pandemic and those treated post-pandemic. When you look at the 10-year trend, the shift is quite dramatic.
Let's get straight to that primary result. What did the annual incidence look like?
This is the headline of the paper. Pre-pandemic, the annual incidence of pediatric intracranial infections requiring neurosurgery was 5.6 cases per year, with a 95% confidence interval of 4.6 to 7.5. But when they looked at the post-pandemic period, that number jumped to 14.4 cases per year.
14.4 cases. That is more than double, nearly triple the pre-pandemic incidence. For a senior attending, that's a significant shift in the clinical burden. If you're a resident or a fellow like yourself, Ilara, that means your exposure to these complex infectious cases has increased substantially in a very short window of time.
It really has. And the 95% confidence interval for that post-pandemic figure was 11.2 to 18.0, so the increase is statistically significant. The paper highlights that this isn't just a minor fluctuation, it's a clear trend.
Why do you think the neurosurgery requirement is the focal point here? We see plenty of infections that are managed medically by our pediatric infectious disease colleagues.
The paper emphasizes that while many intracranial infections can be managed with antibiotics, the ones that require neurosurgery represent the most severe end of the spectrum. Whether it's a subdural empyema causing mass effect or a cerebral abscess requiring stereotactic aspiration, these cases carry the highest morbidity. By focusing on those requiring surgery, the study is essentially looking at the sharp end of the pediatric infection surge.
It's interesting to look at the list of pathologies again: epidural abscess, subdural empyema, cerebral abscess, ventriculitis. In the pediatric population, these often stem from ENT sources, sinusitis or otitis media that crosses the bone or travels via retrograde thrombophlebitis. While the abstract doesn't dive into the specific microbiology in the snippet, the trend itself suggests a shift in how these infections are progressing or presenting post-COVID.
And that's a key point for the residents listening. When we talk about post-COVID-19 in this study, we aren't necessarily saying the children had COVID-19. We are looking at the era following the pandemic lockdowns. There's been a lot of discussion in the literature about the immunity debt, or changes in the circulating strains of common bacteria like Streptococcus pyogenes. This study provides the neurosurgical evidence that these twins are hitting the central nervous system.
Let's talk about the multicenter aspect. They had contributors from Rostock, Bonn, Düsseldorf, Augsburg. This is a representative sample of Germany. It's not just one hotspot center seeing more cases. This suggests a systemic change in pediatric health or pathogen virulence across the region.
I think for a practicing neurosurgeon, the takeaway is the immediate care aspect mentioned in the objectives. With the incidence more than doubling, our index of suspicion for surgical intervention in a child presenting with fever and neurological deficits has to be higher than it was in 2014.
Absolutely. If a child comes in with a sinus headache but shows even subtle lethargy or a focal deficit, we can't afford to wait. The paper categorizes these as life-threatening, and the data shows we are dealing with them much more frequently now.
One thing I found interesting in the study's design was the 10-year look-back. By going back to 2014, they established a very solid baseline of what normal looked like for a decade. That makes the jump to 14.4 cases feel much more like a true departure from the norm, rather than just a busy year.
Right. It's a 10-year trend analysis. It's not just a snapshot. For the medical students listening, it's a great example of how large-scale retrospective multicenter data can identify shifts in disease patterns that a single surgeon might miss in their own practice.
So to summarize the key findings for our listeners, in this German multicenter analysis, the annual incidence of pediatric intracranial infections requiring neurosurgery went from 5.6 cases pre-pandemic to 14.4 cases post-pandemic.
And that covers everything from epidural abscesses to ventriculitis. The message is clear. These cases are on the rise, they are dangerous, and they require our immediate attention.
It's a wake-up call for pediatric neurosurgery units to ensure they have the resources and the on-call readiness to handle this increased volume.
Well said, Ilara. This study is a vital contribution to our understanding of the post-pandemic landscape in neurosurgery. Thanks for diving into it with me today.
Thank you, Dr. Aris. It's definitely a paper that will be cited often as we try to understand these shifting trends.
And that's all for today's episode of the Neurosurgery Hub podcast. Stay sharp, stay informed, and we'll see you in the next one.